Good morning, Dr. Hoy. It's a pleasure to meet you. My name is Benjamin.
My name is Emily.
Today, I want to begin by asking you a question. Can you tell us what psychiatry is?
I think this is a very broad question. What is psychiatry? For narrow definition, psychiatry is a subspecialty of medicine. But maybe someone may say, oh, psychiatry is not quite typical for ordinary medical subspecialties, because for psychiatry we tackle psychiatric illness. Part of them have physical symptoms, but many of the psychiatric disorders, they have somatic and psychiatric and psychological symptoms. That means, for example, depressed mood or anxiety. These are happen inside your mind. So it is quite different from ordinary subspecialty. Also, the psychiatric disorders is quite related to the environment. For example, the social stress for the patient's employment, their family, their marital problem, their financial problem. And for example, recently in Hong Kong, there's COVID-19 and then social movement. All these environmental factors is related. So some people may say psychiatry is a soft medicine. But I would say that psychiatry is a broad medicine that including physical, mental, and social aspects. So it's a big subspecialty.
How did you get into psychiatry?
I get into psychiatry during the clerkship in my student years, and I found that this subspecialty is quite different from other subspecialties because it crosses over medical, psychological, and social. So I feel very interested about it. Before graduated, I go into the internship for 3 months in psychiatry. So after I graduated and finished the internship, I seek jobs in the hospital authority about psychiatry. Many of our classmates, they seek help from different subspecialties, but I only sit in the psychiatry. So at the end, I'm very determined to go into this subspecialty because I feel very interested in this very broad sense of coverage of this subspecialty.
So what is your perception of the public's awareness of psychiatric disorders in Hong Kong?
Well, for the public awareness of psychiatric disorder in Hong Kong, I think is still not very optimal. Many of the people in Hong Kong is quite traditional, and they think that psychiatric disorder is weird or very abnormal and some kind of stigmatizations over the mental illness. They may think that they are mad people, they got to be locked up in a psychiatric institute, and they need to be excluded from the society. But in the modern view of psychiatric disorder, it is talking about we need to include them into the society and rehabilitate them in our whole society. So I think the public awareness is jeopardized by these stigmatizations. Also, many of them, they don't think mood disorder is a real disorder. For example, people having anxiety or depression, they have just physical symptom of headache, maybe gastric pain or abdominal pain. They just go to the medical doctor or surgical doctor. They seldom go to the psychiatric doctor to tackle their mood disorder. So the awareness is very low. So I think we need to do more psychoeducation to the general public to improve the awareness of psychiatric disorder in Hong Kong.
In what ways has COVID-19 impacted Hong Kong's state of psychiatric-related disorders? For example, what are some direct and indirect consequences of the pandemic on psychiatry?
Well, the COVID condition has a great impact in Hong Kong in recent 1 year. And I think there's a different phase of impact. The acute phase, which is last year, you remember last year in Chinese New Year, the COVID has occurred. For acute phase, there's very acute psychiatric reactions to the COVID. For example, there's acute stress reactions, and many people having very fearful feeling, anxieties. They have fear of contamination, they just want to clean all the things, keep on washing their hands, and they have the obsessive compulsive actions, and also fear of illness. They just, for example, some simple illness, they will think, oh, I'm getting the illness or not. So this is the acute consequence. But when the COVID condition is lasting longer, there's become more chronic consequences. For example, people being locked down, they may feel loneliness, they are working from home and they are away from their social circle, and they become more lonely and even more depressed. Some people experience poor motivations and lack of stimulation and feeling loneliness, also depression and anxieties. And when the condition last longer, they may have some psychosocial impact. For example, unemployment and on financial difficulties, and these are more chronic consequences that may have a chronic depression or anxiety in Hong Kong people. These are the impact of COVID in Hong Kong.
Hong Kong also experienced the SARS outbreak in 2003.
Yeah.
So would you say, what kind of similarities and differences would you feel that SARS and COVID-19 has had on psychiatric conditions in Hong Kong?
Well, I think in the SARS experience in 2003, for the acute phase, that's quite similar because the acute phase of SARS, they also have anxiety, fearfulness, or a fear of contamination, a fear of illness. But because the SARS condition is quite a short period of time, so there's limited long-term consequences. But for COVID conditions, because it is become longer, and also the lockdown is more intensive and or extensive broadly over the societies. So the chronic consequences, as I said before, for example, the lockdown, the unemployment, loneliness, and also the depression, anxiety, for COVID, I think is more severe.
It is known that certain psychiatric disorders may result from viral infections. Could you speak more to this observation, especially in this pandemic climate?
Well, I think the viral infection itself, there's some study saying that the viral infection may have impact on the neurological system. Because I'm not working in a hospital setting, I work in the community. I just see people having mental disorders is related to the psychosocial environment. I haven't encountered any COVID cases in my clinic, so I don't know what is the direct consequences. But as I know, some people, they have viral infection, they may have impact on the neurological system. For example, when they're in the hospital, they may have delirium or they may have neurological sign. But I think we need to gather more information to know about what is the direct consequence of the COVID condition into the neurological system.
What do you think the role of psychiatry and psychiatrists are in an epidemic or pandemic?
I think the role of psychiatrists in this pandemic is very, very important. In the acute phases, many people don't know what is this COVID is, so the role is to be on the microbiologists. They need to figure out what is the virus and what is the direct symptoms of the illness. More role in the public health specialists or the respiratory medicine. They are very important. But when the condition lasts longer, and much of the virus we know about is accumulating, but the psychiatric condition is a little bit delayed. In the acute phases, there's not much a severe illness is happening in the society, but now the condition is already last for 1 year. So the pandemic-related mood disorder is accumulating, and also the society is facing a economic depression, and also the extensive lockdown, and also there are other remote problems. For example, the children cannot go to the school, and the parent get more stress, and the carer stress of the parent, they also may have depression or anxieties. So the psychiatrists need to get involved in this COVID condition to take care of the whole society. I think the role of psychiatrists is more important now.
How can medical students and laymen actually address the vulnerability of certain groups, such as elderlies, from suffering psychiatric disorders?
I think for medical students during 5 years study in the medical school, I think you may come across different kind of patients, from the children to the elderly. But for different vulnerability group, elderly is more vulnerable group because first of all, they have advanced age, they have many organ degeneration, for example, dementia or bone problem or the heart problem. The second thing, may have coexisting comorbid multiple medical conditions. They have taken many of the medicine. The medicine also have their side effects, so they become more vulnerable to all these kind of illnesses. For the COVID, you can see the mortality for elderly is more than the young people. So for psychiatrists, when we encounter elderly, first of all, we need to understand what their organic cause is, maybe the first reason for their psychiatric illness. For example, when I encounter elderly in my clinic, I will first of all look into their physical illness, whether they are causing their psychiatric symptoms. And then after that, we need to see whether there's any degenerative cause of the brain, for example, dementia or delirium that cause their psychological symptoms. And also, elderly in Hong Kong, they have the highest rate of suicide. That means their depression, anxiety rate, apart from the organic cause, is higher than young people. So these are the factors that I think medical students need to take into account and study more during their year in medical school, so that in the future, when you go into the hospital to become a doctor, then you can take care of the elderly, especially their vulnerability.
So in our first question, you said that in Hong Kong, it feels like there's a lot of stigma revolving around people seeking psychiatric help. So in that case, what do you think that we can do to lessen the stigma in Hong Kong for people seeking psychiatrists and also surrounding psychiatric disorders?
I think Hong Kong people, they have a stigmatization on the psychiatric disorder is because they have not adequate understanding about the mental illness. I have been working in Hong Kong for more than 20 years in the psychiatric field, and I have do many of the psychosocial education to the public. But until nowadays, still have people in the general public ask me very simple question. For example, they don't know what is the difference between anxiety and depression. So I think this is a very simple question, but still, even have 20 years of extensive psychoeducation, many people still don't understand. So I think for doing psychoeducation to the public is very difficult. We cannot just doing public health talk or just putting a YouTube video or doing all this kind of direct communication. I think we need to do more social engagement. That means we need to welcome all the people in the public to, for example, visit the Psychiatric Institute, talk to those people, the victim of the psychiatric illness, or ask people having their mental illness, talk to the public. Recent years, there has new profession in Hong Kong. We are called peer specialists. Have you heard about that? These are the people being a victim of mental illness, they recover, and then they share their experience to the public. So we call them a peer specialist or peer support worker. Nowadays, in many psychiatric organizations in Hong Kong, we have already employed this kind of peer specialist to work with other people and to talk to the general public, to let them know what kind of mental patient is. And this kind of direct communication and social engagement will improve the stigmatization condition in Hong Kong. So we are looking forward to this new development, and so to help to improve the public awareness of psychiatric illness in Hong Kong.
In your years of experience working as a psychiatrist in Hong Kong, do you think that many people who have experienced sexual abuse have sought help from psychiatrists?
Sexual abuse is very common not only in Hong Kong but also in the foreign country. But in a global setting, there's many studies showing that people having sexual abuse, they have difficulties to get into touch with psychiatrists. First of all, people having sexual abuse, they may have shameful feeling. They may be difficult to talk about their experience. For example, they experience guilt, they experience shame, and also there's some involvement in legal procedures, and during the legal procedures they may feel very painful because they may suppose traumatic stress reaction to the trauma. During the legal procedure is very stressful, so they may not want to talk about this. So I think as a psychiatrist, first of all, we need to understand that those victims are very vulnerable. So many of those patients, first of all, they may get into touch to social worker first. They may be more trust them. And secondly, the social worker will refer them to psychiatric doctor together because those patients may be shameful or difficult to talk about their experiences. And thirdly, those clients need to be handled by psychotherapy. For example, with some female clinical psychologists, which has led them to have a very trustful environment to talk about their experiences. As a psychiatrist, our role is to see whether they have any psychiatric disorder secondary to the trauma. For example, depression, anxiety, PTSD, or other symptoms that need medications. But I think for those victims, they need to have a multidisciplinary approach, not only psychiatrists, but social workers and also psychologists to hand in hand together to handle their condition together.
Thank you very much, Dr. Hui. That's the end of our interview.